Hello, everyone. I'm Philip Snowden, and I'm excited to be running to be your U.S. representative to the 5th Congressional District. I was raised in Dubuque, Louisiana, received an electrical engineering degree from Louisiana Tech University in Ruston, Louisiana, and a master's of business administration from Xavier University, Cincinnati, Ohio. My career has spanned such Fortune 500 companies as General Electric, General Motors, as well as various utility companies, including Entergy right here in Louisiana. I worked in various engineering and managerial capacities, and I also worked in small business. I'm most proud of having quelled a wildcat strike at GE's jet engine facility in Evendale, Ohio, as well as been the design engineer creating the wiring systems for the S10 truck and managed outage operations at an almost $4 billion nuclear power plant. As your representative for the 5th Congressional District, it is my goal to improve technological infrastructure to make sure that all have necessary tools for work, school, and even entertainment at home or in an office. As your representative, it is important that to me that all residents have access to clean water, safe streets, excellent education, and well maintained streets. I'm asking for your support and your vote. I'm number 41 on the ballot, Philip Snowden. Thank you.
Well, thank you, candidate Snowden. And I'm Lisa Deaton. I'm the current Secretary Treasurer for the Louisiana Nurses Political Action Committee. And it's with great pleasure that we sponsor this video chat this morning with candidate Snowden for the 5th Congressional Louisiana District for U.S. Congress. I want the viewing audience to know that these questions were solicited from nurses across the state of Louisiana, and the Board of Trustees finalized 5 questions based upon the social determinants of health and also the most common themes of concerns that the nurses sent in to us. So with that, we're going to get started. And candidate Snowden, the first question is, currently gun violence is a public health issue as evidenced by the CDC rankings. What is your position on providing appropriations to the CDC to fully conduct gun violence research?
I agree with uh, this particular thought, but in addition to funding CDC support of this issue, I would request the U.S. Government Accountability Office review the gun violence issue and report on the status and effectiveness of governmental um, activities in this area across all of the various agencies to address the problem. I feel like a root cause analysis needs to occur so that we can have focus on what are the primary drivers and contributors to this issue. Secondly, we need to be focusing our hard earned tax dollars on activities that are effective and that achieve some results. I feel like it's great to study stuff, and I think we do a good effort at studying, but we really need to determine the primary contributors and go after them and make something good happen. Thank you.
Sure. Okay, question number 2. Researchers agree that there's a direct relationship between poverty and health outcomes. This has been more pronounced during the COVID-19 pandemic. What initiatives would you use to address the effects of poverty on health outcomes and disparities?
This issue has been, studied and studied, I believe, personally. And there have been numerous recommendations made. But I think the next step at the federal level is to require, develop, and implement a strategy such that we are including within that strategy what we should do with regard to education, healthcare, economic development, and environmental uh, efforts toward improving the health outcomes for those that are less endowed financially. And I say education because some of the things that happen with people in this particular strata relate to their eating habits, their um, habits, such as smoking, the amounts of alcohol they consume, and their exercise. So there are things that contribute partially because they are less endowed financially, but some things I believe they could do if they were educated well enough. Um, with regard to healthcare, I think it's super important that we fund our rural and community healthcare centers and hospitals because we need to get them to the doctor as soon as possible, but not to the emergency room. We need them to receive primary care near where they are because most don't have the transportation. And finally, if we look at economic development, that makes it possible for them to move from public healthcare necessarily to private insurance through their employers. And even if they use the same uh, healthcare entities, the clinics, rural clinics, and community health centers, which are just as good in terms of quality, at least we have the private entities paying into those systems. And finally, environmental. Most less endowed financially, um, uh, um, financially low income people live in areas that are um, predisposed to elements from industry. And we do need to make sure that we are having a clean environment. It affects them first, but they're just the um, canary in the coal chef, so to speak. So we need to have regulations that have it such that we have clean air and water, period. And that will help the situation of those less endowed.
Okay. The Affordable Care Act has made healthcare available to millions, including per diem RNs. Do you support the continuation and improvement of the Affordable Care Act? If not, how will you ensure all Americans have access to healthcare?
Of course, I support the Affordable Care Act, and I also want to see improvements thereon. And if we are so unlucky as to have it repealed, I'm hopeful that before it's repealed, if that turns out to be the case, that an alternative that includes all of the various things that are wonderful about it are so included in the replacement. Yeah, and normally the replacement is just a new name on the same thing. So I um, I wholeheartedly support the Affordable Care Act. I think it provides um, health care for people that otherwise wouldn't have it, and it's important that everyone is healthy because the healthier our society or the individuals within our society are, the more productive they can be, and thereby contribute to the betterment of us all. And secondly, I will say this: to the extent that we take care of those less endowed financially, the better off we all are, because they can transmit communicable diseases. And it is important for us to take care of everybody so all of us are taken care of. Thank you.
Okay. We are all aware of the rising cost of medications, which often have citizens making choices to feed their families or buy their medications. Oftentimes, when working people are retiring and are on a fixed income, such as Social Security, the cost of medication skyrockets. What are your plans to reduce and control medication costs?
Well, I agree with having it such that the medications costs in this country are on par with those in other countries. And I know that that puts a somewhat crimp on our pharmaceuticals, whether they are here in the States or they are abroad, in terms of their corporate offices. But I believe that if we put everybody on uh, an even keel, it will make it such that those companies find ways to make drugs at a cost that will be good for everybody. The innovation and creativity of those companies, and they have to be quite innovative um, and creative in order to come up with some of the therapeutics and cures for some of the various maladies we are beseeched by. Uh, and as a consequence of pushing them to have equalized pricing, we push them to be creative in coming up with all of these new things. And that's the only way that it will happen. We can wish all we please. Unless we put everybody on an even keel, it's not going to happen. And that means that the Veterans Administration, along with Medicare, are able to negotiate prices because they have the benefit of huge volumes. And we need to make it such that they can negotiate, but negotiate based upon world prices, not artificially high prices that we see in the US.
Okay. Well, our last question. Registered nurses are ranked as the most trusted profession on the Gallup poll. As the largest segment of the healthcare workforce, the 2010 Institute of Medicine report recommended that nurses lead the transformation of healthcare in collaboration with other healthcare professionals and policymakers. How could you assist with getting qualified nurses on national boards, commissions, task force, as well as appointing RNs to your staff if elected?
Well, I feel that registered nurses bring a unique frontline perspective to the healthcare discussion. They are right there with the patients, and it's there on the front line that you learn some of the best practices, things, learn whether one thing works versus another. So their perspective will be unique, and I believe that it should be valued and respected. I would also actively encourage supporting opportunities to raise registered nurses' profile and voices in any and all healthcare discussions. I think that all bills that and even discussions that are brought before Congress should have input from our registered nurses. And I finally I would say that registered nurses have too much expertise and experience to not be included in the discussions. And that's my take on it. Absolutely.
Okay, well, thank you very much. We want to thank you for taking part in the video chat and for providing your responses to these questions that are important to the nurses across the state of Louisiana. And we would like to now give you a few brief minutes to give a closing remark.
All right. Ladies and gentlemen, we're at a crossroads. We can stay where we are now, which is where we were 68 years ago when I was a child. And or we can continue to a brighter future. You know, Louisiana has always been in competition with Mississippi for the 48th or 49th spot. It does not have to be that way. We can accomplish this brighter future, I believe, if we apply common sense solutions. And I'm going to only address a couple of items. And that is one, improving upon the Affordable Care Act. Right now, when we have so many people besieged, by this coronavirus pandemic, we cannot have it be such that quality health care is not availed. We just cannot have it such that fewer people have availability of healthcare services. And I'm going to say this: healthy people can more fully contribute to society. We won't bring ourselves not only out of the pandemic, but out of this economic depression that we're about to uh, approach unless we have healthy people. Healthy people don't go, only healthy people go out and buy things and work and go on vacation. We also should be thinking about how we fund healthcare. It shouldn't be this piecemeal. We're gonna um, fund partially, say, community and rural health um, clinics and hospitals. That should be an ongoing effort, and they should know that their budgets are going to be um, addressed. Their budget needs are going to be addressed. So we can make the 5th Congressional District a sought after place to live, work, raise a family, and retire. With your backing and through faith, we can do this. We will do this. I appreciate your time, open mindedness, forward thinking commitment. Thank you so much for listening to me. God bless you. God bless Louisiana. And God bless the United States of America. And remember, vote Phillip Snowden, number 41 on the ballot. Thank you very much.